Hello, poultry enthusiasts. Welcome to my channel. This is Dr. Rolly, your online poultry consultant. If you are new here, please like, share, subscribe, and hit the bell so you will be notified on my next videos. Today, our discussion will be all about health. What are the common bacterial, viral, fungal, and parasitic diseases that commonly encountered in poultry farming? This will be a series of discussion, so I will divide this into parts so I can explain it to you on a clear manner. So stay watching up to the end of this video. Okay guys, let me start with the common bacterial infections in both broilers and layers. First is the E. coli. This disease affects all ages of poultry. There is a yellow-colored, soft and watery feces, depression, decreased appetite, cough, and labored breathing. This bacteria is ingested via a contaminated drinking water. Birds may show ruffled feathers. Birds become dull, lethargic, with fluffy wings, and refuse to eat or drink. It always separates itself from other birds. This results to high mortality rate. Birds may die in 3 to 5 days. Regular water analysis is necessary, especially if the source is deep well. Now next is the salmonellosis. This disease is caused by Salmonella bacteria, and there are several types of salmonellosis in poultry. First is the bacillary white diarrhea or pullorum disease that is caused by Salmonella pullorum. These feces are colored white and there is a soiling of the vent just below the anus. This is a hatchery-borne disease transmitted to eggs. Chicks always stay near to the source of heat and always appear sleepy. There is an absorbed yolk which is common to this disease. There is a focal necrosis on the liver, accumulate fats on the heart, and cheesy materials on the intestine. Another salmonella is the fowl typhoid, which is caused by Salmonella gallinarum. There's also a diarrhea of dark color, usually affects growing birds, and with high mortality rates. These birds are dehydrated, with swollen and vile-stained liver and degeneration of ova. Picture shows all the lesions that you can find in the birds that are affected with this salmonella. Another is the fowl cholera. This is caused by Pasteurella multocida. There is an anorexia, a fever, diarrhea, mucus discharge from the mouth, there's depression, ruffled feather, swelling of the face, and panting. There are two types of this fowl cholera. First is the acute septicemia, and second is the chronic septicemia. In acute septicemia, morbidity and high mortality are very prominent, and death is so sudden. The birds are depressed, cyanotic or bluish face, and no appetite. There is a nasal and oral discharge, green diarrhea, emaciated with swollen comb. In chronic form, there is swelling of the wattles, sinuses, joints, foot pads, cheesy exudates in the conjunctiva sac. Birds lose its balance. The head and neck are pulled back over to the body and between the legs. The picture shows all the signs and lesions that you can find in birds affected with fowl cholera. Now, this frequently occurs in stressed birds associated with parasitism, malnutrition, poor sanitation, and biosecurity. The liver is congested with multiple foci. The heart is also congested with white necrotic foci, and the ova are hemorrhagic. Next is the chronic respiratory disease, or the so-called CRD, which is caused by Mycoplasma gallisepticum. There is a swelling of the face, marked rales, difficulty in breathing, coughing, and sneezing. There is also a nasal discharge and used to scratch the nose during early stage of the disease. There is also a swelling of the face. The trachea or the throat is hemorrhagic upon necrosis. There is also a cloudy appearance of the abdominal air sac in the 7-week-old chicken, and pericarditis and perihepatitis in an 8-week-old chicken. The last is tuberculosis. This is a chronic granulomatous disease of poultry caused by Mycobacterium avium. Signs includes depressed and progressive loss of weight, leading to emaciation, pale skin of face, wattles, and comb, dull and ruffled feathers. There's also diarrhea and unilateral lameness. Lesions are found in the liver and intestines, such as nodules and tubercles. Now, let us go to common viral diseases that usually affects your broilers and layers as well as breeders. The most common viral disease of poultry is the Newcastle disease or avian pneumoencephalitis, or the so-called NCD. This is caused by paramyxovirus and divided into 3 types: the lentogenic, which is very low, the mesogenic, which is the intermediate type, and the velogenic, which is the highly infectious. The lentogenic type is the low infectious type among the 3. It spreads very fast within the flocks and causes big economic loss. The mesogenic type of NCD is the milder type of infection, while the velogenic type is the highly infectious type among the 3. Nervous signs may not be seen, but the intestine is affected, as well as egg production. The NCD usually occurs at the first 7 days of bird's life. Reinfection may occur during the laying stage if there is a failure of vaccination. Signs are swelling of the eye. There's a mucus discharge coming from the mouth area. There is nervous signs called torticollis, or the so-called twisting of the head and neck, others called stargazing. There are hemorrhages on the proventricular mucosa, gizzard, and intestinal serosa. The birds, once affected, cannot be recovered. Revaccination is helpful and can be part of the health program. This can be done at 30 weeks to 35 weeks of age in layers or breeders. Next is avian influenza. This viral disease of poultry is caused by orthomyxovirus type A highly pathogenic. Signs and symptoms include greenish diarrhea, cyanotic and edema of the head, comb, and wattle, ecchymotic or dark red discoloration of shank and feet, blood-stained oral and nasal discharges. The morbidity and mortality are too high and spread rapidly. The picture shows all the lesions of this avian influenza disease. Another infection is called infectious bronchitis. This is caused by adenovirus or avian serotype 1. Signs and symptoms include coughing, rattling, 18 to 48 hours after exposure. There's a slight nasal discharge, swelling of the face, lacrimation, and rales. There's a 100% morbidity and 60% mortality rate. There's a sharp drop of egg production. The drop feed intake, misshapen eggs, and thin-shelled eggs. Usually 20 to 50% decrease on egg production. This viral disease causes severe economic loss, and it is very hard to recover from this kind of viral disease. Another viral disease is called foulpox. This virus is caused by large DNA pox virus. This has two types, the dry type and the wet type. The dry type is the most prevalent type of foulpox. This is usually starts as erased, blanched nodules in the comb, wattles, nose, and unfeathered part of the face. In the cheeks, lesions are limited to the legs and feet. Another is the egg drop syndrome. This condition is caused by adenovirus. Signs and symptoms include shell-less eggs, soft-shelled eggs, loss of pigments in the case of quail. The hen tends to eat the shell-less eggs. There is 10 to 40% drop in egg production. Now picture shows the signs and lesions of the eggs caused by egg drop syndrome. Another is gumboro or infectious bursal disease, or the so-called IBD. This is a highly pathogenic and detrimental disease of poultry that usually occur in the first 3 weeks of chicken, but can infect adults. This is caused by IVD virus. This is usually a subclinical type and chicken suddenly died. This affects the bursa, making it enlarged, hemorrhagic, and there is also an hemorrhagic lesion that can be found in the legs area. Now let's go to common parasitic diseases of poultry. The first one is coccidiosis. This is caused by several strains of coccidia called Eimeria. This affects the intestinal tract, causing decreased growth rate, high mortality, and severe diarrhea. There is also a decrease in feed intakes and water consumption, weight loss, and decreased egg production. Picture shows the signs and lesions of this kind of disease. Next is helminthiasis. This is caused by several intestinal worms that affects egg production and can cause severe health problem. There are two common worms of concern in poultry, the nematodes and the cestodes. Nematodes are round worms that exhibit sexual differences. There is male and female, wherein male is much smaller than the female. Just take a look at the picture and see the difference between male and female roundworm. Next is the cestodes. These cestodes are flatworms or tapeworms and does not exhibit sexual differences. They are hermaphrodites and multiply through the so-called proglottids, which are arranged in segments. Once the proglottid is fertilized, it will detach from the segment and become infective. The head is called scolex and also use their mouth for attachment in the intestine. Then our last topic are the ticks, the flea, and the mites. This causes anemia in poultry and affects egg production. Ticks usually attach to the feathers in the wings, body, and neck, while mites usually found in the scales on the feet of the chicken. They used to suck blood to fertilize them. The fleas are usually present in the body of the chicken, but very hard to see because of their leaping ability. They can easily leap from one place to another. So that's all for now, and I hope you learned something again from this topic. Thank you for watching.